The Elder Care Protection Bill just became law. Here's what it actually means for you. Stop what you're doing, because something just passed in the United States Senate that could directly change your retirement, your healthcare, and your financial security starting this year. Millions of American retirees have no idea what's actually inside it. We're talking about stronger protections against nursing home abuse, new limits on prescription drug costs for seniors, and updated rules that could put real money back in your Social Security check. But here's what the mainstream media isn't telling you. Not every change is automatic. Some benefits only kick in if you know how to claim them. And there are critical deadlines you could miss if you wait too long. We're breaking down every major change in plain English. No legal jargon, no political spin. So you and your family know exactly what you're now entitled to and what steps to take right now to protect your future. Let's get into it. Where this bill came from. For decades, seniors in this country have been fighting a system that wasn't built with them in mind. Prescription drug prices that made no sense. Nursing homes operating with almost zero accountability. Social Security adjustments that barely kept up with the real cost of living. Elder financial fraud that robbed hardworking retirees of their life savings. These weren't small inconveniences. These were crises playing out quietly in millions of households across America. And most of it was happening without nearly enough attention from lawmakers. The Elder Care Protection Bill is one of the most comprehensive pieces of legislation targeting seniors in a generation. It touches nearly every area of life that matters most to people over 60. Healthcare, housing, finances, and personal safety. And the reason we need to talk about it in such detail is because the news cycle moves fast. And what usually gets reported are the headlines. But the details, the actual practical real-life details where the real value lives for you. Durastad prescription drug pricing reform. One of the first and most talked about pieces of this bill involves prescription drug pricing. If you're on Medicare, this is something you've been waiting a long time to hear. For years, Medicare was legally prohibited from negotiating drug prices directly with pharmaceutical companies. Think about that for a moment. The largest purchaser of prescription drugs in the entire country was not allowed to use that size and power to negotiate lower prices. Private insurance companies could negotiate. The Department of Veterans Affairs could negotiate, but Medicare, which covers over 65 million Americans, could not. The result was that seniors were paying some of the highest drug prices in the world for the exact same medications that people in Canada, Germany, and Japan were getting for a fraction of the cost. The Elder Care Protection Bill expands and accelerates the drug pricing reform process. Under the new provisions, Medicare will be able to negotiate prices on a significantly broader list of medications, and those negotiated prices will take effect faster than previous timelines allowed. What this means in practical terms is that if you're currently spending $200, $300, even $500 a month on medications for conditions like diabetes, heart disease, or arthritis, there is a real possibility that those costs come down, not in some vague fair-off future, on a rolling schedule that begins implementation now. The bill also caps out-of-pocket drug costs for Medicare beneficiaries, meaning there's a ceiling on what you'll ever have to pay in a given year. Regardless of how many medications you take or how expensive they are for millions of seniors who have been forced to choose between their medication and their groceries, this is not a small thing. This is life-changing. Durst Social Security changes. Now let's talk about Social Security because this is the one that gets people fired up, and rightfully so. Social Security has been the financial backbone of retirement in America since 1935. It was designed as a promise. You work, you contribute, and when your working years are done, the system takes care of you. But over time, that promise started to feel a little shaky. Cost of living adjustments, known as COLA, are supposed to protect your benefits from inflation. Every year, the Social Security Administration looks at inflation numbers and adjusts your monthly payment accordingly. But here's the problem, and this is something that seniors have been saying for years. The inflation formula used to calculate those adjustments does not reflect how seniors actually spend their money. The standard formula tracks the spending habits of urban wage earners and clerical workers. It factors in things like gasoline, electronics, and work-related expenses. But seniors spend their money differently. They spend far more on healthcare, on prescription drugs, on in-home assistance. those categories go up in price faster than almost anything else in the economy. The Elder Care Protection Bill addresses this directly. It pushes for the adoption of an inflation index specifically designed to track senior spending patterns. What this means is that your annual Social Security adjustment would actually reflect what your life costs, not what a young working professional's life costs. Over time, this can mean hundreds of dollars more per year in your pocket. It doesn't sound like a revolution, but when you're living on a fixed income, a more accurate inflation adjustment every single year adds up to something very real and very significant. There's also language in the bill that addresses the long-standing issue of Social Security's long-term funding. Without going too deep into the technical details, the concern has always been that the Social Security Trust Fund would face depletion somewhere around the mid-2030s, which would have triggered automatic benefit cuts. Nobody wanted that. The bill includes provisions that strengthen the funding structure, primarily by adjusting the payroll tax cap, meaning that higher income earners contribute more into the system, which helps stabilize it for everyone. This protects your benefits not just today, but for decades to come. And if you have children or grandchildren who will one day rely on Social Security themselves, this matters for them too. D. Nursing home reform. Let's move on to nursing home reform because this is a part of the bill that doesn't get talked about nearly enough, and it's absolutely critical. If you or someone you love is currently in a nursing home, or if you're thinking ahead about the possibility of needing that level of care someday, what happens inside those facilities matters enormously. The unfortunate reality is that nursing home abuse and neglect in America has been a persistent, devastating problem. Reports from the Department of Health and Human Services have consistently shown that a significant percentage of nursing homes across the country have been cited for serious violations. Things like inadequate staffing, poor sanitation, medication errors, and, in the worst cases, physical and emotional abuse of residents. Under the Elder Care Protection Bill, nursing homes that receive Medicare and Medicaid funding, which is the vast majority of them, are now subject to much stricter staffing requirements. The new rules mandate minimum staffing ratios, meaning there must be a certain number of trained caregivers for every resident in the facility. This sounds like a bureaucratic detail, but what it actually means is that your mother or father will have a real human being available to help them when they need it, rather than a single overworked aide trying to manage an entire hallway of patients alone. Understaffing has been the root cause of countless tragedies in nursing homes, and this bill takes direct aim at that problem. The bill also dramatically increases the penalties for facilities that are found to have violated resident safety standards. In the past, the fines were so small that many nursing homes simply treated them as a cost of doing business. That changes now. Fines are going up significantly, and repeat offenders face the possibility of losing their Medicare and Medicaid funding altogether, which for most facilities is essentially a death sentence for the business. That creates a powerful financial incentive to actually follow the rules and treat residents with dignity. Additionally, there are new transparency requirements. Nursing homes must now make their inspection reports, staffing data, and violation histories more easily accessible to the public. That means when you're researching a facility for yourself or a loved one, you'll have access to real information, not just the glossy brochure they hand you at the front desk. Elder Financial Fraud Protection. Now, let's spend some time on something that doesn't get nearly the attention it deserves, and that's elder financial fraud. This is a silent epidemic in America. Every year, older Americans lose tens of billions of dollars to scammers, con artists, and financial predators. The schemes come in all shapes and sizes. Phone calls from fake IRS agents, Medicare fraud, investment scams, romance scams targeting lonely widows and widowers, contractors who take a deposit and disappear, and even family members or caregivers who take advantage of access to an elderly person's finances. The FBI has consistently ranked elder financial exploitation as one of the fastest growing crimes in the country, and the victims are often too ashamed or too confused to report what happened to them. The Elder Care Protection Bill creates a dedicated funding stream for elder fraud prevention and prosecution. This means more federal investigators specifically trained to recognize and pursue these cases, more resources for victim support and recovery, and stronger coordination between federal agencies, state law enforcement, and financial institutions. Banks and credit unions are now encouraged and in some cases required to flag suspicious transactions in accounts held by seniors and to have protocols in place for reporting potential exploitation. This is huge because in many cases the bank is the first institution to see the warning signs. A sudden large withdrawal, multiple wire transfers to an unfamiliar account, a new name added to an account held by an elderly customer. These are red flags, and under the new framework, financial institutions have both the tools and the responsibility to act on them. There's also a major push in the bill to fund public education campaigns specifically targeting seniors because here's the truth. The best defense against these scams is knowledge. When you know what to look for, when you understand the tactics that fraudsters use, you're far less likely to become a victim. Housing and aging in place. Let's talk about housing now, because for many seniors, their home is their single largest asset and the center of their entire life. The ability to age in place, to grow older in the home you've lived in, surrounded by your memories and your community, is something that most people want deeply. But the reality is that our homes often aren't built for the later stages of life. Stairs become dangerous. Bathrooms without grabbers become accident sites. Doorways too narrow for a wheelchair become barriers to independence. Making the modifications necessary to safely age in place can cost thousands of dollars. And for many seniors on fixed incomes, that money simply isn't available. The Elder Care Protection Bill significantly expands funding for home modification assistance programs. Through grants and low-interest loan programs administered at the local level, eligible seniors can now access financial help to make critical safety improvements to their homes. Things like installing ramps, widening doorways, adding walk-in showers, improving lighting, and making kitchens more accessible. These are not luxury renovations. These are the basic modifications that allow a person to stay safe and independent in their own home, rather than being forced into a care facility before they're truly ready. The bill also addresses affordable senior housing more broadly. There's a significant investment in expanding the supply of affordable housing options designed specifically for older Americans, communities that offer accessibility features, proximity to healthcare services, and opportunities for social connection. Isolation is one of the most serious health risks facing seniors today. Studies have shown that chronic loneliness among older adults is as damaging to your health as smoking 15 cigarettes a day. That's not an exaggeration. That's what the research shows. By investing in housing that's designed to keep seniors connected to their communities, this bill is addressing not just physical health, but mental and emotional well-being as well. 2. Mental health access. Speaking of mental health, and this is something people don't like to talk about openly enough, the Elder Care Protection Bill includes provisions specifically expanding access to mental health services for seniors on Medicare. Right now, accessing mental health care through Medicare can be complicated, expensive, and limited. Many therapists and counselors don't accept Medicare patients. The reimbursement rates are low enough that providers often choose not to participate. And the stigma around mental health, which remains especially strong in older generations who grew up in an era where you simply didn't talk about these things, keeps many seniors from seeking help even when they desperately need it. The bill works to remove some of those barriers by improving reimbursement rates for mental health providers who serve Medicare patients, and by expanding telehealth options so that seniors in rural areas or those with mobility challenges can access counseling from the comfort of their own homes. Grief, loss, chronic pain, the fear of dependency. These are real emotional burdens that millions of older Americans carry every day. The idea that seeking help for those burdens is somehow weak or unnecessary is simply wrong. And it's an idea that this legislation is working to push back against caregiver support. Let's talk about caregiver support because this is something that falls through the cracks in nearly every policy conversation. Yet, it affects tens of millions of families across this country. Right now, there are an estimated 53 million unpaid family caregivers in the United States. These are sons and daughters, spouses, siblings, and friends who have taken on the enormous responsibility of caring for an aging loved one, often while also working full-time, raising their own children, and managing their own health. The physical and emotional toll of caregiving is staggering. Caregiver burnout is real. Depression among caregivers is extraordinarily common. And yet historically, these individuals have received almost no financial support, no formal training, and very little recognition from the government for the work they do. The Elder Care Protection Bill changes that in meaningful ways. There are new tax credits available for family caregivers. People who are spending their own money on their loved one's care can now recoup some of those costs through the tax system. There's also funding for caregiver training programs so that family members who are helping manage complex medical conditions at home have access to the education and support they need to do that safely and effectively. And there are expanded respite care options which allow caregivers to take temporary breaks without feeling like they're abandoning their responsibilities. A caregiver who is rested, supported, and educated is a better caregiver. And a better caregiver means a better quality of life for the senior they're caring for. This is a win in every direction. C-Course Medicare expansion. Now let's address something that's been in the news recently in connection with this bill, and that's the broader conversation about Medicare expansion. There has been significant debate about whether to expand Medicare coverage to include dental, vision, and hearing services. Right now, original Medicare does not cover routine dental care, routine eye exams, or hearing aids. This is a glaring gap in the system because dental health is directly connected to overall health. Untreated gum disease has been linked to heart disease, diabetes complications, and cognitive decline. Vision problems in older adults increase the risk of falls, accidents, and social isolation. And untreated hearing loss is one of the strongest, modifiable risk factors for dementia. These are not vanity services. These are fundamental healthcare needs. The Elder Care Protection Bill makes significant progress on this front. While a full expansion of Medicare to cover all dental, vision, and hearing needs remains a work in progress politically, this bill includes real steps in that direction. There are new subsidies available to help Medicare beneficiaries afford hearing aids, which, as many of you know, can cost thousands of dollars and are rarely covered by insurance. There are pilot programs expanding access to dental care through federally qualified health centers for Medicare patients. And there's increased funding for vision care services through community health programs. It's not everything that advocates have pushed for, but it's a meaningful step forward, and it's absolutely heading in the right direction. What you need to do right now. Now, I want to talk about something that might seem a little different from the rest, but it's connected to everything we've been discussing, and that's the issue of staying informed. One of the most important things you can do in the wake of this legislation is to make sure you understand your own situation, what you're currently receiving, what you might now be eligible for, and what steps you need to take to access new benefits. Because, as we mentioned at the beginning, not everything in this bill is automatic. Some benefits require an application. Some require that you update your information with Medicare or Social Security. Some have enrollment windows that you don't want to miss. The best place to start is with your local Social Security office or by visiting the official Social Security Administration website. If you have a Medicare counselor through your state health insurance assistance program, which is a free service available in every state, this is a great time to make an appointment. These counselors are trained to help you understand your Medicare benefits and navigate changes exactly like the ones this bill introduces. They're free, they're unbiased, and they're there specifically to help people in your situation. Also, and this is important, be very careful about anyone who reaches out to you claiming to help you apply for new benefits under this bill and asking for money or personal information up front. Scammers move fast. Within days of any major piece of legislation passing, con artists are already crafting pitches around it to trick seniors into giving up their Medicare number, their Social Security number, or their bank account information. Legitimate government services are always free. The Social Security Administration will never call you and demand immediate action. Medicare will never ask for your credit card number over the phone. If something feels wrong, hang up, close the browser, and call the official number directly. Final thoughts. Think about your own life. Think about the specific things that have kept you up at night or the specific moments when you felt like the system was not designed for you. Maybe it was standing at the pharmacy counter and having to decide which prescription to fill this month because you couldn't afford all of them. Maybe it was watching a parent suffer in a facility that didn't have enough staff to give them proper care. Maybe it was getting a call from your bank about a transaction you didn't recognize and realizing with a sinking feeling that someone had been stealing from you. Maybe it was sitting alone on a Tuesday afternoon wondering if anyone out there understood how hard this stage of life can be. This bill is not a magic solution. No single piece of legislation can fix everything, but it is a genuine, substantial effort to make the lives of older Americans better in tangible, real-world ways. And perhaps more than anything, it is a signal that the United States Senate looked at the challenges facing seniors and said, "We see you, we hear you, and we're going to do something about it." After years of feeling invisible in policy conversations, that matters. There are still battles ahead. Implementation takes time. Funding fights happen every budget cycle. The people who benefit most from keeping things the way they are, the pharmaceutical companies, the understaffed nursing home chains, the financial predators, will not go quietly. They will lobby. They will litigate. They will try to chip away at the progress that has been made, which is exactly why it matters that you stay informed, stay engaged, and stay connected to this conversation. Because the best protection for any law is an informed public that understands what's at stake and refuses to let it be taken away. Knowledge is power. Subscribe my channel for more valuable content. And please turn on bell button